Well, our new facility is going to be serving a population that cannot be in their own home during their end-of-life care. So that could be people who have no family, they live alone, people who have family members who need to work and maintain their insurance and their income. It may be for people who are very sick and their symptoms cannot be managed in a home care setting. So there's different levels of hospice care that can be provided in that facility.
It's going to be a home for individuals and their families that are facing end of life. So we started doing that planning and design, and then we decided to do the capital campaign, and we've started that, and we're moving forward with it. We opted to build an 18-bed hospice home, hospice inpatient facility to serve those individuals' needs. This community opens up and gives, and even when we're struggling with the economy the way we are, people give, and it's just so heartwarming.
We did have Brenda Ho, our executive director, and Karen Moriuchi, one of our board members, go on several site visits to mainland facilities, trying to look for the best possible that we could put into the facilities as far as kitchen and what types of things and what worked and what didn't work.
It was really a good experience, and I enjoyed working with the group there, planning, how would the families feel the most comfortable in there, what kind of rooms would be available, is there a separate room that we could have for the children when they get, kind of antsy and they have some place to go and expend some of that energy, some places about having some serenity and being able to relax. Families who travel far, there's a kitchen for them to cook at or a place to do laundry. So that part was fun on the planning part, learning what we see in facilities and how we can make this facility as comfortable for our patients and families there.
And we also hired an architect consultant that specializes in building hospice type facilities. So a lot of groundwork has been done along those lines.
Hospice is the highest, best practice quality care for individuals that are facing end of life. A lot of people think hospice is just for the elderly, that we're only providing this care for those that we expect to die. Actually, hospice is designed not just for the elderly, but there isn't any one age group. Everybody deserves hospice. Everybody's entitled to hospice care. And I just want to make sure that that's always available.
And what's really key is we want to set up a memory, an environment so that the memory for these individuals, these children, and even the adults, is that their loved one was in the best place, getting the best care that they could during that final journey, and they were part of that.
The studies have shown that people that are in hospice actually live longer than patients with the same disease process that are not in hospice. And part of the reason for that is when we're addressing the needs, managing those symptoms that are going on, so people want to live. They feel more comfortable with that. And hospice is trying to recreate that ability for patients that don't have their own home, or their ability to be in their own home in our inpatient facility. It's meant to be welcoming. We're even talking about making cookies all the time, just so you can smell cookies when you walk in the door. It is a home. We want everybody to feel like it's a home.
When you walk in the door, there's a living room. There's a dining room.
When you walk into the center of the building, or the Pico, there's a beautiful art piece that we're putting there that will be part of the donor recognition for everyone that gave $5,000 or more. We'll be putting their names around that beautiful piece of art, which is a kukui nut tree, which is really symbolism of a hospice and healthcare.
Across the area right there in that room is a family room, a kitchen, a couch.
If somebody's running in from work and bringing a bento lunch, they can go eat lunch with whoever's in that facility, their loved one or family member or friend. And then there's on one side is something special that we're very, very committed to, is a patient care spa. Being immersed in warm water is so soothing and comforting. We want to make that a primary piece of our care that we provide in this facility. So we're very, very excited about that.
When I review things and look at patients I see in the hospital, as well as my own patients who I know can't be taken care of at home, I know they're dying, and I know they need these more intensive medications. There's no place else to be but in the hospital. And the hospital has its role, but usually the hospital's role is really to get people better and get them home, not to have them die there. That's really my personal as well as my medical opinion. This residential facility is that bridge to a more comfortable place to be, but still have the intensive therapy and medications and crew of healthcare providers to make that dying process easier for the patient as well as the family. The residential facility has areas for the family to be and stay and be close in as homey a setting as possible, but it just can't be done at home. And the monitoring with the nursing staff 24/7, the adjustment of medications that are needed on a more than a daily basis is really where the inpatient unit fits that niche, and we don't have that here.
We will continue to operate our home care program out of this facility, but there will be a whole new staff in the new inpatient facility, an expansion of the staff that we offer here. We're looking at hiring anywhere from 30 to 40 new staff, RNs, nurses aides, social workers. There's a lot of employment opportunities related to the facility, a lot of volunteer opportunities. Sometimes volunteers like to come in and have a concrete place to be and work. There's a lot of growth in the university around healthcare alliance type fields. So, as they expand into physical therapy, occupational therapy, more social work schools, and so forth, hospice will be another site that they can use. And the inpatient facility makes it a little bit easier to do training than in the home setting. But by both ways, then we'll be able to give and support the educational programs that are out there in our community. I feel very, very honored and privileged to live in Hilo and to be part of this community, because this community really takes care. They take care of all of their people that are in need, but especially as it relates to individuals that are facing end of life and their families. They really come out and embrace. And when hospice asks for help, people step up and they're so gracious, and so they share that they're honored to be part of and support this project and support our program. And again, I just think we have something special here, and it's all because of the people that make up the island of Hawaii.